This is what happens when my partner in crime is not here. That partner is Ruth Del Pino. She is the Drug-Free Communities Grant Coordinator. As I mentioned previously, she is on a training right now for a new venture that I will talk about soon. Yes, I still have my Christmas tree up. I figured it's easier to own it than to try to hide it. And another thing is my kids had COVID, and while they were home and while we were all stuck here, I was like, I literally said every single day, let's undecorate, let's take down our Christmas list, and you see how far that got. So anyway, so welcome. We're glad to have you here. I do see some new faces. If you don't mind just putting your name and your organization in the chat, we will at the end go around and we'll do introductions now is fine. We usually start with introductions. Let me just call up I'm just calling up our register here so I can make sure I have everyone. All right. I will call on you and in the order that I see you. And if you'll just give a brief introduction of where you're from. Later on in the meeting, I will give you an opportunity to do any announcements of any events you have coming up or anything that you want to share with the group. But for now, just your name and your affiliation would be great. I'm going to start with Mr. Al Grupper.
Hey, how is everybody? I'm from the East Windsor Municipal Alliance.
I'm so glad to have you. All right, Ann DeGennaro.
Good morning, everybody. Ann DeGennaro from Lawrence High School, Student Assistance Counselor. Shout out to Maggie. Maggie, our guy is doing fantastic. He's going on 10 months sobriety. So I just wanted to share that out. This is the power of this coalition. This is what happens when people work together. So I needed to give you a shout out, Mag. So thank you so much. I really appreciate that.
I'm so happy to hear that. That's the bottom line. Like, just, that's wonderful. Thank you.
Welcome.
I love that. Go ahead, Maggie, introduce yourself. We'll skip around.
Okay. Well, thanks, everybody. Maggie Giovanni. I have been on this coalition in the past under Sprout Health Group, but I am now working with Footprints to Recovery as of early October. So Maggie Giovanni with Footprints to Recovery. Thank you for having me.
We are so glad to have you. And Chelsea.
Hi everyone, I'm Chelsea Stack. I am the new Youth Prevention Manager at the Institute for Prevention and Recovery, the DART Coalition.
Hey, and then I have John.
Oh, hi. How are you? John Ryan, Mayor of Lawrence Township, and just here to lend my support and whatever I can do.
He also serves on the Municipal Alliance for Alcohol and Drugs in Lawrence. And that's how all of us met. And he was also pivotal in our International Overdose Awareness Day. So we have strong ties to you. And now we are, congratulations on being mayor.
Thank you so much.
Angelo.
Good morning, everyone. I'm Angelo Raganisi. I'm with the Department of Mental Health and Addiction Services. I work with the PFS grant, and I'm not the mayor of anything.
All right, Sergeant Martinez.
Good morning, everyone. I am Sergeant Benjamin Martinez. I am with the New Jersey National Guard Counter Drug Task Force. I am in the Drug Demand Reduction Outreach section. And yeah.
Those are a lot of little titles and departments.
Oh, so many. We do so much here.
Okay, and then I see Thomas, but I see Carol. I'm assuming that's somebody else's account there.
Yeah, I'm using a different computer at the office. I'm Carol Nicholas with the Greater Mercer Public Health Partnership and also the Lawrence Health Department. And we've been members with you guys for decades, I think. So it's a pleasure to see you all.
We are so glad to have you. All right, Dan. I know you're busy.
Good morning, everyone. My name is Dan Winter. I work for the Mercer Council, actually, and I'm the program director for the Assist School-Based Youth Services Program, and we're based out of Ewing High School. Nice to see everybody.
We're glad to have you. Ashley.
Thank you.
Hi, good morning, everybody. My name is Ashley Soudal. I work for New Jersey Prevention Network with the regional coalitions.
I'm trying to take notes at the same time. So, okay, Camille.
Good morning, everyone. My name is Camille Bloomberg. I'm in private practice in Pennington, New Jersey. I've been with the coalition since it started.
We are so grateful for that as well. Next, I have Shannon.
For some reason, it's saying failed to start camera. Good morning, everyone. I'm Shannon McFuture, and I'm Mercer County Municipal Alliance Coordinator. Been with the county for about 5 years and in this department for 3. Thank you.
We're glad you're here. And then I saw Heidi pop in.
Good morning, everyone. Heidi Kami with the Hopewell Valley Municipal Alliance and also Student Program Coordinator at Hopewell Valley Regional School District.
Wonderful. Jocelyn, are you available? At one point, she said she had to take a call, so I wasn't sure if she was back yet. But Jocelyn is our Executive Director here at Mercer Council for a while. Vanessa.
Hi, good morning. Vanessa DeRosa from Mercer Council.
Okay, Sophia.
Good morning, everyone. Sophia Johnson from Department of Children and Families, CSOC, and I'm the Prevention Coordinator on the PFS grant.
We're so glad to have you. Thanks for being here, Sophia. And then Amy, I'm not sure which Amy that is.
Good morning, it's Amy from Mercer Council.
I do now. And then we have Miss Shakita Johnson. She is also from the Assist program at Ewing High School. She works with Dan and she is a marvel with youth and everything she does. And then I have a phone number here, 609. I'm assuming that might be Jocelyn, but if not, you want to introduce yourself? Okay, so we will proceed from there then. Okay, so welcome to the new year. Happy New Year. I hope it's gone well. We are officially 12 days in, and it's already seeming like it's going to be a big one. You know, you guys already heard my kids had COVID, and it's interesting coming into the new year with all the changes. As you might notice, Barb Spreckman is not here anymore. She is currently in an RV careening down the East Coast in retirement, as she should be. And then we also received some news early on this year, and I was hoping she'd be able to give it herself, but Jocelyn Cooper is stepping down as our executive director and moving on to some really other exciting possibilities. And we're so excited for her because, you know, she's young, she's so talented, she's so connected to the community, but we're really upset because that means she's leaving us. So if you guys know anyone with counseling background who might want to be our executive director, please reach out because we want a good one, because she can't be replaced, but someone needs to take the position. So as I said, some big changes happening with the council, and not necessarily the coalition, but you know, they do affect one another, that's for sure. For those of you who are not aware, the Prevention Coalition of Mercer County is housed within the Mercer Council on Alcoholism and Drug Addiction. That is our fiscal agent, and we work in tandem with all of the goals with those as well. We would now like to take a minute to allow our co-chairperson to speak. Our co-chair people are Andy Gennaro and Jayashree. Jayashree is in India this month, and she said she was going to try to join us, but you know, she has family ties that are pulling her right now, and we definitely told her to take her vacation and to focus on her family. But she has been behind the scenes working really hard. She is the co-chair she is the chair of Lawrence
Project Graduation.
Project Graduation. Sorry, my brain. But she is working very hard in especially the area of underage drinking, and just making sure that the students are tied into all the resources that they need in their communities, especially during this time. And she asked permission if she could start doing stuff year round. And I think the answer was resoundingly yes, because you care about our kids and we want those protective factors built in. So Anne, as our co-chair here in country, you can take it away. Just, you know, it's yours.
Do my motivational speech. I'm not sure where I want to go with this. So okay. So what do I want to say? I want to say first, Happy New Year to everybody. And I want to say thank you to everyone that is continuing to stay on course and keep our motivation and keep our momentum going in a time right now in our world, in our society, in our communities that's been really, really tough. And I know I did a shout out to Maggie, but that's just a tiny little blip of what we can do in our communities and collectively work together, which I think this coalition does so well, which is why I actually said I would be willing to be the co-chair of something like this, because this group has a lot to offer. And what I do miss, I gotta be honest with you, Melissa, what I do miss sometimes is having the opportunity to share out, you know, what resources we have, what opportunities we have, because I can give you a really quick snapshot of our kids. And, you know, just from the vibe and from what I'm seeing and what I'm researching about and this is just, you know, teens and tweens. Well, actually even younger than that now, guys. I was in LIS, which is our intermediate school, and we have some youngins experimenting with vaping and, you know, that kind of stuff. And the incredibly interesting opportunity I had in speaking with these kids is, and it's not just about using substances, but it's about coping skills. I am hearing more and more that these kids are finding their coping skills through social media and TikTok and Instagram, and they don't really do Facebook that much. But when I ask these students, like in particular, I'm really going to make this short, but I run these two groups, fairly large groups, and I asked them to share a dark time in their life and how they got themselves out of that dark space. Of the 7 students that had the opportunity to speak, and of those 7 students that were speaking, all of which used the coping mechanism of cutting, of the 7, 5 shared that they were following this person on Instagram and TikTok who utilized this coping skill, and they related to this person, so they started cutting. This is extremely disturbing to me. And so our mission, I believe, is, you know, we are battling a much larger monster than we can ever imagine. But I don't want us to lose sight that every little piece that we can change in a kid is going to make that difference in the future to them. And I truly believe that. I am on a mission with this. I am passionate about it. I started an Instagram post, and I do it every day now. It's called the Daily, and don't laugh at it because my administration wouldn't let me put it out here in our school, but it's called Daily Dose of D. Don't get fresh, all you perverted people out there. It's about D, vitamin D, feeling good, and really about like doing things that are going to make you better. I think we all need to start doing this for ourselves, for our kids. We're in a place right now that's really difficult. So I just want to say thank you again to everything that you all do and all of your passion and all of your energy. And please just make sure you take care of yourselves too, because that's really super important, especially now with, you know, the new strains and and all that other great stuff. So I'm seeing it in my work. I'm seeing it outside of my work. You know, we really need to address the mental health issues of our communities. And this is an important concept. And I really think that I want to say again, thank you to all of you that are out here today. And I wish you would show your faces, because I like to see faces of people that are making a difference. So I want to say thanks again, and let's keep moving, man. We got to keep moving, even though virtual is a tough space. But you know what? And the other thing is, our kids are having a very difficult time now that we are doing a little virtual work now. Their anxiety levels are going off the charts because they don't want to show their faces on Zoom. So we're having a very challenging time with all of this stuff. But thank you all to what you do, how you do it, your passion. You don't let go, and I so appreciate that. And I know I'm speaking for Melissa as well. So I want to say thanks and keep on going, man. Let's just keep on going, because we can make a difference.
Thanks for all you do, Ann. I'm on a couple community boards, and listening to the people talk about the school and even on social media, just listening to people talk about what the schools are doing and, you know, what are they doing? Are they, you know, what are they doing to our kids? And, you know, it's this back and forth. And right now it's really hard to please anyone because we're scared. We don't know. We don't have all the information. We want to protect our kids. We want our kids to be in school. We want them to be socialized. We want them to be, you know, germ free. We don't want, you know, there's so many variables that we're never going to make anyone happy. And I know that children are picking up on that. You know, youth have their own opinions on all of these things. And to be honest, we're just trying to keep people healthy and safe. And that's exactly what our goal is, what a big part of our mission is here as part of the Prevention Coalition, is keeping our communities safe and healthy and trying to guide them to the proper resources. And we really appreciate everyone who is a resource and who is just an agent of change, just like Ann said. Kimi Carlos, we did a Kimi Carlos training at the beginning of last year, and she said, I want everyone to put on their Zoom change agent after their name. And I did that for a little while, and then it felt a little presumptuous, I don't know. But if you think about what we're trying to do, we're trying to change environmental factors. We're trying to increase protective factors for our youth and for our communities, and decrease risk factors. And all of us do that in our day-to-day work and in the efforts that we have. So thank you very much. Our formal presentation today is from Sergeant Martinez. He's going to just tell us briefly about what he does, and then we'll have an opportunity for questions for him and possible ways that we can work together. So Sergeant Martinez.
Yes, thank you so much. Thank you. So yeah, no, I'm Sergeant Martinez. As I mentioned before, I'm with the Counter Drug Task Force. And what we do in Counter Drug is essentially help you guys establish the foundational things that we need for strategic prevention. So we help community organizations apply to receive grant funding and execute it on effective drug prevention strategies in the community. We receive training on the strategic prevention framework, which is the bread and butter of organizations creating a vision and implementing change. And we also understand the 12 sectors of prevention, as well as CADCA's 7 strategies. And anything from assessment to evaluation to sustainability is essentially what we try and help most communities that we work with try to establish in their earlier stages of prevention. And we essentially like to enter the door, offer everything we can to help you guys, you know, succeed in your mission, and then kind of let you take the reins from there on and kind of monitor and help where we can as far as leadership and strategic prevention goes. We're versed in community assessments and creation of surveys, data evaluation, and bring knowledge what coalitions across the state are doing, as well as what we are currently using as data trends and what's happening in the affected areas around us. We have an inclusive mapping initiative as well, which is used to create digital or printable maps for your community when it relates to substance abuse and preventions, overview, environmental scans, as well as insight for video or graphical outreach for public relations. I was brought on specifically to counter drug as a public affairs representative. My job in the National Guard is mass communications. So I work with photography, videography, photojournalism, and graphic design. And I've been helping a lot with the storyboards for counter drug in the last couple months. And essentially what that is we try to push out as much information on a certain subject that we can gather as much information possible to help coalitions kind of establish what information is being shared across the board for the state as prevention goes and substance abuse goes, and or substance use, I should say, instead of abuse. So when we work with your alliance and members, we are bringing a tactical sense of advisement regarding the strategic prevention framework, and as well as giving graphical tools to push this information out to the public so that it's easily understandable across the board, and that we're all on the same page as far as substance use goes and what we can do to prevent it further going forward with prevention. And yeah, that's everything that I got.
Right. So is this task force for the entire state? Do you have a couple county area? What area do you cover?
So we separate our sections into the 3 sectors of New Jersey alone. So we have a group of us working in the north, we have some guys working central and as well as south. And we work across the state and help coalitions in each county that we can, as far as mapping goes and things like that. So we would essentially take your data that you gathered through surveys or questionnaires and things like that, and we would input them into OD maps or other mapping tools that we have used to kind of give a visual representation of what we're looking for and how we can move forward with prevention to kind of lower those numbers across the state.
Fantastic. Does anybody else have any other questions? I know that we have talked about like environmental mapping before with your group. Did anyone take them up on that? That's something we should set a goal for this year, is to do some more environmental mapping. I know, so for those of you who aren't sure what environmental mapping is, and some of these mapping tools that Sergeant Martinez is talking about. So if, for example, I know that when my municipality was interested in where we were going to issue our cannabis licenses, the areas, we wanted to get a map of residential in, we wanted a map of residential, we wanted industry, things that were zoned for business. And then we also wanted all the alcohol sellers, all the alcohol establishments listed as well. I believe that's something that could be done through your system as well. Is that correct?
Absolutely. Yes. We can go over, you know, what businesses are currently distributing alcoholic beverages or anything that's required to be 21 or over. And we can look into, not necessarily look into their licensing, but to see how far away they are from current schools, how far along they are from, you know, children, really. And from there, we would give that to you, and using the 12 sectors within your coalition, we can figure out, how long has this business been here and are they grandfathered in before the law took place? And if not, we need to make sure that they are going about the right steps for distributing alcohol and they're not selling to children. Same thing with tobacco products, vaping products, and with the rise of, the legalization of marijuana, we're looking into a lot of marijuana distributors and dispensaries and things. And with the ever-changing laws and things, we've been keeping an eye on, CBD, vaping, flavored vapes, kratom especially, and of course marijuana, and how it's packaged and how it's distributed to make sure that children aren't necessarily finding it so easily, and that the dispensaries and businesses across the state are abiding by the same laws as everywhere else.
Incredibly valuable. So we absolutely need to utilize that better and,
Absolutely, yeah.
And to work with you better. I see Anne unmuted because I knew you would, because now I'm like, wait, why have we done this before? So go ahead, Anne.
I was just curious, Sarge, what are you seeing with the mapping that you have currently done, especially in the face of, the legalization of marijuana? Like, what are you seeing in communities? It's a challenge on our end, to get a handle on this, but I'm curious, like, what have you guys have been seeing through your lens, as far as your mapping is concerned? Like, what are you seeing?
So on our end, we're seeing a lot of ups and downs across the state. We have counties that are opting out immediately, and we have counties that are opted in and looking forward to, having distributors or dispensaries in their counties and things like that. So marijuana being such a sensitive topic for a lot of people, it always goes back to that perception of harm. Like, you have some people who are in a position to give their word and to actually advocate for marijuana. They're in positions where they can make these changes and say, hey, this could be used as a medical benefit. But on the other side of that, we have a lot of biased opinions or just hatred for it, that they're completely saying no, and they're not giving it a chance. And, not saying that, it's right or wrong, but at the end of the day, a lot of people aren't on the same page yet, and it all derives from that perception of harm. So a lot of it is just straining from lack of education or even too much education, to where not enough people are listening to each other. And the counties that have opted in, they've been really advocating for it. And then the counties who haven't, they're not even giving it a chance. And from what I've seen, as far as opting in and out goes, the state legislature can kind of like move in and say, hey, this is a high traffic area. If we have to put a dispensary here, then we might have to, whether you opt in or not. And if you opt out, you have 5 years to do so. And if you opt in, then you're locked into that legislature for at least the next 5 years, if I'm getting that correctly. But
so legislation, like the bigwigs can say to a community, we see traffic here, we'd like you to put a dispensary in. Is that what I'm hearing you say?
Last I heard about it, that was the case. And if that is to happen, of course, there's a lot of channels that they would have to go through, but they would still advocate for themselves, like, no, we do not want dispensaries. And then in that case, it would say, all right, we won't put a dispensary here, but how would you feel for you people to get deliveries? And if you're opting out of one, you're essentially opting out of both. So there's no dispensaries in the county and there's no deliveries available. So counties that are opting out of both of those options are saying, we don't want it in our county at all. No townships will have dispensaries or deliveries here, operating out of here at least. And a lot of it is, coming from out of state, being able to deliver from out of state into our borders like Hoboken and Jersey City and things like that, coming straight from New York, and, Philadelphia being right there, and then going into Camden, things like that. A lot of it is, like it's a lot of up and down, especially with the things changing with the legislature constantly. it all depends on, you know, the oversight of, you know, what's going to happen with the legalization of it. And is it going to be across the state or is it going to be by county?
This is Angelo from DMOS, and I just, first of all, thank you for being here and giving us this information. I know that in past meetings, I heard that businesses can be grandfathered in. So like, even if a county after 5 years decides not to, or that they see problems, that they don't want to opt in any longer, that the businesses that are there already have the right to stay there, even if they don't want them there. Is that correct?
Yes, that is correct.
So that's something else that people should consider. And the fact that I am a little uneasy of that, if the people in the county decide that they don't want that there, that that it can wind up being there anyway. That's a little disturbing to me. I gotta say.
Yeah, like I understand. Oh, sorry, I'm sorry, Melissa.
No, I hadn't heard that until this morning when John Ryan mentioned it, and
Yeah.
I'm gonna have to go back and check because I've been following that pretty closely, and I hadn't heard that they had that kind of override. I know delivery is mandatory. No matter where you live, you have to allow delivery.
Oh, okay, so that must have changed recently then, yeah, because from what I understood before, it was an option, but yeah, no, that's yeah, so that's, again, it goes back to that ever-changing thing, you know, it's constantly changing.
No, and the CRC isn't as transparent as I'd like it to be. You know, they've canceled a lot of meetings, and they have to shorten the meetings, and I need to pay better attention. Is really what it boils down to. But you know, just thinking about utilizing some of your resources, drug impact zones, like what you were talking about, like how far are these establishments from areas where children frequent? I mean, that is absolutely a discussion that people are having right now with issuing these licenses in the municipalities. That would be incredibly beneficial to know what the footage is, because, you know, we have so many with the Clean Air Act and with the drug-free school zones. We have these, okay, establishment can only be, you know, 2,000 feet or whatever, but how many people truly know what that is? Like, I've done my best with Google Maps, but you know, it'd be really great to have that in a more exact way. I see Anne, you want to
I myself need a little clarification. With the dispensaries, do you still need a medical card to be able to purchase these things? Because I'm hearing, Sergeant, that there are a few dispensaries that you can walk in and buy whatever you want, and they don't ask for a card. That's a concern to me.
Yeah, that is a very big concern. From what I understand, as the legislature goes, I don't remember seeing anything about needing a card, but being over the age of 21 and you know, of course, like not having more than 6 ounces on your person, things like that. So that is something I would have to look into further. So I can definitely get better answers on that.
I would really appreciate that if we could get clarification on that.
Absolutely.
Because I really think that's to me, that's going to be my super concern. Our kids are not purchasing from dispensaries, but I think they're getting their marijuana from someone who can get their drugs from a dispensary.
Camille, I see you. I'll get to you in just a second, but and my understanding is that legally and legitimately, there are no retail establishments for recreational use because the licenses haven't been issued yet. However, culturally, people might say, you know, like store owners might say, well, it's legal now, so yeah, I might as well, you know, I can sell it without, but it's the oversight and the enforcement of there, you know, there's very little ramification for if they do sell to someone without a card. So that's, you know, so what's considered legal? So technically all cannabis is marijuana right now because it's not being sold by a recreational facility. unless it's being sold for medical purposes with a card. So, all right, Camille, I'm sorry, go ahead.
No, so I was going to add to, as with alcohol, there are regulations, right? But we know people go in and buy for kids, and we know that. So I foresee this becoming very similar when the licenses become for recreational use as well. And the broadness of what you can get a card for is amazing. I mean, you could say, I stubbed my toe, and you can get a medical marijuana card. So there's lots and lots and lots of people out there that are getting cards for all kinds of things. And yes, that's going to happen. But I think in terms of us as preventative measures, we need to talk about the age is 21, just like drinking is 21, and work in a preventative way. This is happening, people. It's going through, it's happening. And how are we as a prevention coalition going to work to educate our community, educate our parents, educate the kids, you know, regardless of whether it's recreational or medical, you have to be 21 as a young person to purchase this in any level. So let's start doing preventative work to educate and push the idea of how are we going to get you to understand to make informed decisions? And that's where I think we should put our energy. This idea of who gets what, how they get it, whatever. I know it's concerning, but that's not where our energy needs to be. Our energy needs to be in how do we prevent young people from using this like it's no big deal. It is a big deal. So let's put our, and that's my opinion, put our energy towards that.
Well, that is absolutely the way we work. You know, every single group that we address, we're like, first of all, it's not legal, medical, recreation, or otherwise, unless you're 21 or over. And this is why. And then we go through brain development and why adolescent bodies are different than adult bodies. And I think that is the biggest distinction that we're trying to let adults know, even more than kids. Because you can tell kids something, and if they don't believe it, it doesn't matter. But if we let adults know, and I think that that's an area of focus, parents have always been one of our hardest groups to tap into. Ironically, we need to let them know there is a difference. There is a difference if you're putting these substances in your body. There is a difference in brain development. There's a difference in body development and the impacts that has. Absolutely, that is absolutely where we focus our prevention efforts and our harm reduction efforts, because we know that people are going to use. We just want them to use responsibly, or we know that they have the opportunity to use. We want them to do it responsibly with all the information that they need to have. So thank you so much, Sergeant Martinez. Would you mind putting your contact information or the best way to reach you in the chat?
Absolutely, yes. I did that earlier on.
Oh, okay.
So it should be up there. I can send it one more time.
Yeah, if you don't mind.
Yeah, no, that's fine.
All right, thank you.
All right, there is my email. One more thing before I get done here. Do I have permission to share my screen for a second?
Oh, absolutely. Let me just add you as a host.
So one of my colleagues, Sergeant Sarah, he works with Passaic County Coalition, and he put together this updated marijuana summary. And let's see. Can you see my screen?
Yes.
All right, so this is what he was able to put together. It's a complete update and breakdown of the information about the legislature that goes into the marijuana laws itself and how it impacts the youth, the health impact, marketing and promotion, the penalties for it, and growing. Everything is broken down in this PDF. And if you guys would like, I can definitely share it with you guys. I'll email it to Melissa, and you can push it out as well. Just to kind of get like a brief overview of what the legislature looks like, and by category. If you're interested in the growing, the tax revenue, it comes down, community impact, and cannabis consumption areas. It's broken down very well, and he spent a lot of time on this in the last 2 years that this has been in the works. So Yeah, I'll email this and any other information that I have as far as the legislature goes. And yeah, if you guys have any questions, feel free to reach out as far as mapping and things like that. We're here to help for it all. So if there's anything that you guys are interested in, just let us know.
I'm very interested in the maps. How do we access the maps?
If you have any data that you would like to find out about, so for example, if you have any number of we'll say number of liquor stores in your county, and we would go into that information, and then we would create that map and locate each liquor store in this and highlight their area of impact and where they're located specifically. And we can also include bus routes, walking routes from, say, the liquor store to the school, or vice versa, and how we can eliminate any, what's the word I'm looking for? Kind of barriers in, any barriers that might come into play as far as schools, parks, liquor stores, dispensaries, and how easily accessible they are for the public.
Melissa, I think we should have that as part of our database, don't you?
Absolutely. I was just thinking of your impact study that you did, and then our survey information. And actually, this is kind of a good transition to our next order of business, which we were going to be talking about our action teams. And one of our action teams, the RX and opioids, is Carol Nicholas's. She is the chair, action team leader for that. And one of the things we were talking about was an environmental impact study. And this is kind of what I was talking about with the mapping and seeing how it plays out in an environment. So absolutely, we could definitely, it's definitely, that's one of the reasons why I had you on here, because I know there is things that we can be doing that we aren't using, and I definitely want to do that. So Carol, if you wouldn't mind, can you talk a little bit about some of the ideas that you have for your action team and some of the things that we've discussed?
I did not come prepared at all, and all my stuff is actually at home. So
okay.
I mean, our goal is to get the drugs away from the kids. So we're going to be starting, I work with Carol Chamberlain to co-chair this. And actually, if you're interested in joining this action team, could you let Melissa know? Because she wants to collect the names of who's going to which group. So I would appreciate that if you could let Melissa know if this is something you're interested in. So right now, Carol and I have just started by trying to get some basic information. Who's collecting the drugs, how many pounds a year, which communities are collecting the most, and then sort of review, well, how are we getting this information out to the people so that they know they can go and clean out Granny's medicine cabinet and take those drugs and put them in at the police departments. And so once we get all that information, it'll become clear where we need to act and where we need to and how we should go about it. So I think that's the first thing on our agenda. And then actually, Melissa, you had a whole list of things in an email that we just got very excited with also, but I don't have that email in front of me to list some of those things. Can you remember?
One was talking about Narcan and the open prescription that is available at local pharmacies. Which pharmacies do drug collection? Because we hear about this all the time. Oh, CVS will take it. Well,
yeah,
not every CVS.
Yeah.
And not every, so-and-so's pharmacy will take it. Well, not really.
Yeah.
So those kind of things, clarifying that, and just getting some resources. We also have a card that we distribute on how to get rid of prescription drugs. And that is outdated and needs to be updated too. And we talked about some of those efforts too.
You've jogged my memory. Carol and I were going to try and reach out to the Pharmacy Association so that we can really see if we can get them on board and get them starting to collect the drugs. When I went up to Canada to visit family, anytime you have leftover drugs, you can just walk into the pharmacy and leave your old drugs there. You don't have to, go to the police department. So since you're already going to the pharmacy, it's just like an easy peasy thing to do. So we're going to see if we can work with the pharmacists and just see if they have like a Mercer County Pharmacy Association, because we don't even know where we're starting off with that group. So that'll be something we're looking into.
It's great. I know the pharmacies are so inundated right now with COVID testing and vaccines, and I know public health departments are overwhelmed with that as well. So we really appreciate all the efforts that you're putting into it. Another thing I was thinking of is, it just left me too. So we were jogging each other's memories and then it just left me. But we have access to Narcan training. If you know anyone who wants to be Narcan trained, there are 2 agencies right now that have the grant where they can train you online and then send you the kit. So there's no excuse. Get it. It's less than an hour's worth of training. It's not that you're certified or anything like that. It's just you know how to use it. And I believe I shared with the group, but through some interesting means, one of the kits that I placed was actually used the next day and saved someone's life. And I've been doing these trainings for 4 years now, and that was the first time I had heard back from someone who got the training. And I, you know, it's huge to know that we can save someone's life so that they can get the resources we need. And I think that's one thing that's left out of that discussion is with harm reduction is, yes, we're saving their lives and we can go back and forth about choices and, you know, habits and addictions back and forth, but the person is alive so that we can still have those discussions. And I think that's the really important thing. Yes, Camille.
You were a change agent.
Yeah, right. Right.
So
Okay.
I did all the fraternities and sororities have to do this risk management program that they have to do every year, and talking about drugs and alcohol. And I insisted that the president and 2 other officers of the fraternity where I did the program get Narcan trained. And they got sent the kit so that every fraternity and sorority should have one of those. And I think maybe if we push that, we have Princeton, TCNJ, Rider, Westminster, all the colleges right here. I think it would be beneficial to us to make that a goal, that, you know, all of the risk management programs include the Narcan training. It's free to them. They can go online and get them in whatever, you know, in Mercer County, and every fraternity and sorority on campus should have that kit.
Yeah.
Just a thought.
Fantastic. I did remember the other thing. One thing that the Prevention Coalition has done in the past, and we would like to work with the action group to work with this, is that we've worked with funeral directors, specifically the funeral director program, training program at Mercer County Community College, to remind families of people who have passed from a terminal illness, from a long-term illness, that have tons and tons of medications stacked up on how to get rid of them. Because there has been some evidence that those families are targeted, those homes are targeted because people know they have medications in the home, especially when after the person passes away. You know, there's an urban legend out there that you can't put the date and time of the service because that's when people break in and steal drugs and all kinds of things. So that's definitely another area that our action team could go. Now we do, I don't want to put anybody on the spot like I did Carol, but we do have 3 more action groups. We have Underage Drinking. That is chaired by Desi. He is a detective who is at TCNJ, and we've been working with him in some capacities. They had a national night out for the college campus, because if you think about National Night Out, it's in the summer when there's no college students on campus. So they held one for their college students to get to know their officers and to get involved. And that was a great opportunity. So we did talk to them. Then we also have a marijuana action group, and that is chaired by Heidi Kame. And do you want to take a second? Heidi, I don't mean to put you on the spot, but if you want to say anything, you're welcome to.
Hi, thank you. So I guess sort of working a little bit, unfortunately, in a bubble, most probably due to COVID. I just personally continue to do a lot of research on the subject and very excited to be attending in April the Stanford School of Medicine Cannabis Awareness Conference. I attended last year, which I think was in February. Learned a tremendous amount from other states and made a lot of connections with folks in places like Colorado and Oregon and Washington, and really just trying to let folks know sort of the lessons that we can learn from sort of their failures. So I'm hopeful to learn more of that. And if anybody is interested in joining the small group, let me know, and be happy to start brainstorming on some things that we can do to, I think really at this point, educate is probably the most important thing we can do at this point. It's going to be hard to keep these dispensaries at bay, unfortunately, because I think people are going to start to see the tax revenues to their municipalities. So, you know, as much as it pains me to accept that, I think it unfortunately is going to become a reality. So I think at this point, it's a matter of educating our youth. The sad news is, you know, I'm still extremely concerned about the levels of THC. And I know there's a huge argument in the medical marijuana end of things that they don't want to see a limit to THC because just like an opioid, well, one, of course, they're going behind, well, I shouldn't say going behind a shield, but I said it, didn't I? A veil that, you know, they're trying to oppose opioids, which obviously I oppose opioids, but they're saying, look, if the same relief can come from medical marijuana, you know, that will help the opioid epidemic, which, yes, I agree with that. But the medical marijuana folks do not want to see limits to THC because just like, you know, your pain increases, your THC level in whatever cannabis you're consuming is going to have to replicate that and increase to help you sustain, you know, some kind of a decent living, you know, whatever the word is I'm looking for. So in any event, I think the THCs right now is something that has me most concerned. And again, I think nobody knows until we know what the impact's going to be once we see it in our community, because nobody's going to think it's going to happen here until it happens here. So that's my story. Thanks for my time, Melissa.
And Andy Gennaro offered to be part of your action group. So write that one down. Hold her to that.
Thank you, Anne.
We appreciate that. And then our last action group is tobacco and nicotine, and that's the one that I'm leading the charge on. And we just actually had a state meeting last night with our youth group, and we have redefined what we're going to work on for this year. And it's really, really great. We're going to take, we're going to divide up the calendar quarterly. We're going to do social justice and taking down tobacco, which is the effort that we do every March. It's a national effort. It used to be called Kick Butts Day, but now it's called Take Down Tobacco Day. The social justice areas of that is just the communities that the tobacco industry targets, and that includes, thank you. I see people leaving. I know it's been an hour, but we appreciate you being here. If you have to drop off, that's great. We appreciate your time. But they do target communities of color with their advertising, and also the LGBTQIA sector of the community, just because, you know, if they see certain vulnerabilities or certain areas that they can target, they will target it. Tobacco has some of the best people in the biz. And then tobacco and the environment, there is a huge environmental impact. Cessation, which is kind of the quarter we're in right now, new year, new you, quit smoking, you know, that kind of thing. Great American Smokeout, that happens in November. And then just overall health and wellness. So those are some of the avenues that I'm working on with the youth. We did have a sticker shock last month for alcohol. As you are aware, we go through and give out informational stickers in alcohol establishments, you know, talking about buying for under 21. But we also met and talked a little bit about vaping and marijuana efforts and how we can reach youth. And we talked a little bit about social media. I have 4 girls right now that are very, very willing to work and to talk to their peers. And I'm super excited about some of the future of our youth coalition. Ruth is going to be working with that. Any questions about our action teams?
I have a question about your Takedown Tobacco Day. Is that quarterly? You're going to do that quarterly or just once for the year?
So the actual Takedown Tobacco Day is, it's usually in March. And then there is Takedown Tobacco Day is usually April 1st. That's so there are 2 major tobacco holidays, I guess you can call it. Takedown Tobacco Day, which is April 1st, and then Great American Smokeout, which is November 16th or right around there. November 18th was this year. So I think it's the 3rd Thursday in April or something. It's the Thursday before Thanksgiving, I believe. So those are the 2 that we target, that we try to do big pushes for, especially with our youth. But we do all of that year, you know, we're obviously doing prevention programs and cessation programs year round, or having those.
Through the GMPHP, I'm connected with all the health officers in Mercer County. So if you have a plan, you know, of what you want, we can get that out to them so that they can get on board with, because this is exactly the kind of thing that they like to participate into also. So if you can just let me know, you know, in March, or April, March, what the plan is for April 1st, then I can make sure they get it. And we get some support from the health departments.
Okay. While we're at it, some other dates that I wanted to mention is March 21st through the 27th is National Drug and Alcohol Facts Week. We will hopefully we'll be working with Anne and local schools and any other organizations that want assistance on that. Pretty much we're promoting facts versus myths. And that is both on drugs and alcohol. That is something that is sponsored by NIDA, which is the National Institute of Drug Abuse, and by SAMHSA. April is Alcohol Awareness Month, as well as the informal holiday 420. So that's where we're going to be targeting our efforts are on those 2 things. May is Mental Health Awareness Month. And then, of course, our big events at the end of the year are in August, ironically, the only month that we don't meet as a coalition, and that is National Nights Out, which we work with the police departments in all of our municipalities, and then the International Overdose Awareness Day, which is held at the end of the month. September is National Recovery Month, and I know that we work with recovery advocates and several of our other partners. So that's just an overview of some of the things that we will be focusing on this year. Next, at the end of the month, at the beginning of next month, end of this month, we are going to CADCA, which Sergeant Martinez mentioned. That is the coalition, anti-drug coalition coordinating agency that is our national group. It's international at this point. They're the ones who teach us the strategic framework. They're the ones who help set the strategies so that we can organize these different things and help us to frame what kind of work we want to do as a coalition. So that will be at the end of this month and the beginning of next month. So at this time, I would like to turn the time over to all of you to announce any events or any upcoming projects that you're working on that you might want the coalition to know about, or if you want assistance on those things, we'd be happy to hear from you. Jamie, I did see you wrote something in the text. Jamie didn't have a chance to introduce herself. So Jamie, if you want to go ahead and introduce yourself, and we'll talk about those things.
Yeah, I appreciate it. And I apologize. We're getting ready for the students to come back. So I work at Rider University. I'm in the Office of Community Standards. So we got a lot of moving parts right now. And that's including COVID and how we are managing that. And for those who I haven't met with from previous coalition meetings, I also absorbed Susan Stolley's responsibilities when she transitioned out. So actually with everything, and I've been working with Melissa and Ruth, and they have been, and Barbara before she retired, and they have been absolute dream to work with. So, and it's been really nice hearing all the things that are happening with this coalition. So I actually kind of wanted to, you know, when you go through like a common center and there's a bulletin board and it's like looking for a dog walker, looking for a babysitter. I kind of have one that's like looking for collaboration and resources, and anyone that would like to connect with me and implement events, programming, outreach to our students, that would be excellent. So the Narcan one, Camille had mentioned Rider, and that's absolutely something that I'm interested in. So I will leave my email in the chat box. It's really simple. It's just jwright@rider.edu. But especially with this year, we were able to do some large scale programming. And now I want to kind of work on the smaller increments of it, just because what this restructuring was, we didn't know what it looked like. And now I think we're kind of getting the feel of it. So, so yeah, please don't hesitate to reach out to me. Email is best. It might take me a little bit right now as we get ready for the spring, but so still super excited to hear all of this support and enthusiasm really for this, because I'm kind of in my own bubble as well. Like Heidi said, I'm kind of the only one doing this. So any community stuff is really helpful.
Thank you, Jamie, and thank you for what you do. We appreciate you being here.
Thanks. I try. I have one job.
Right. Two others that joined us later on, Investigator Armano, would you mind just introducing yourself? And if you have anything you want to announce, you're welcome to.
Investigator Joe Armano. I've been with the coalition for a while. Can you hear me?
Yep.
Okay. So I've been with the coalition for a while, and I just put up on the chat about the drug collection box that we have at the Mercer County Sheriff's Office. We have a substation in the basement. I don't know if a lot of people know, we have a substation with probably, there's about 15 of us down here at the 40 administration building, 640 South Broad Street, McDade administration building. And we're in the basement. We do have a drug collection box we've had down here for probably about 4 or 5 years now, or maybe more. If anybody does know someone that has drugs that they need to get rid of, they can literally just drop them off right at the front desk, and the security officers just can distribute them to us. So they'll bring them to us, and we put them in it's like a mailbox that was converted. I'm also working on going to a meeting soon with Bergen County to possibly create a new program for the Mercer County Sheriff's Office. I'm looking to start a Path Forward truck program here at the Mercer County Sheriff's Office. Just another program added to the programs that we have, and I'm in the beginning stages of it. I actually started working on this January 1st.
I'm not familiar with that. What is that address?
A Path Forward truck. It's a truck that they converted to. It's a community outreach vehicle.
Great.
And it's something I'm very interested in. I had a brother that was addicted to opioids, and it's something I'm very interested in. I'm hoping that it works out, but I have to. It's in the beginning stages, and I have to set up a meeting with Bergen to actually see how it's done first. Then I have to present it. I'll let everybody. I'll let you know when I have my first meeting. Afterwards.
No, we would appreciate hearing more about that as that unfolds.
Absolutely.
I know our start packet. We're redoing our start packet. I know that we've done that in coordination with the prosecutor's office and the sheriff's office for years now. And you know, if we can roll that truck onto streets and get those in the hands of people who need it, along with
A
other
stack of them
resources.
behind me. Those
All right.
packets. I have a stack of them right behind me, actually. And
They overtook my life for a while here too.
I bet. So I'm working on it, and I'll let everybody know whether it goes forward or how we're going to go forward with it.
Thank you so
in
much.
the future. Okay.
I appreciate that. And then Vin, I did see you jump on the call. We're so glad to have you. Go ahead and introduce yourself. And then if you have anything you want to announce, go ahead.
Thank you, Melissa. My name is Vin Bickler, and I'm with the Council on Compulsive Gambling of New Jersey. Our headquarters is in Hamilton, but we serve people with problem gambling and the loved ones of problem gamblers throughout the state. I'm really happy to be a part of this coalition. And just quickly, for Joe's benefit, you might want to contact the people in Atlantic County. They have a bus, a huge bus that sounds similar to what you're trying to do. It's called Hope One, run by the sheriff's office in Atlantic County out of Mays Landing. And it is a tremendous group. I'm involved with them in that county too. The other thing is, and again, directing to Joe, I'm working with the president of the State Sheriff's Association. The president happens to be Mike Mastronardi, the sheriff of Ocean County, who in 1975 was a student in one of my public speaking classes at Central Regional High School. Well, he's hooked me up with the state sheriffs. We're supposed to speak there on the 27th of this month, their meeting in Trenton, but it's been postponed because of the COVID situation. Hopefully in February, I'll address them. But Mike has hooked me up with, and I've been able to connect with police departments in the Shore area. And Joe, my contact information I put in the chat in portion there. If you'd like to contact me, I'd love to be involved with helping the sheriff's department of Mercer County too, and obviously other law enforcement agencies I'm working with. And thank God they've changed the name. We no longer have drug courts in the state of New Jersey. They're now officially recovery courts. And I'm working with the counties along the shore area from Cape May up to Monmouth County. And we can help in Mercer also in that court area. So Joe, if you have connections there with people that you might put me in touch with, or they contact me, be happy to help in the recovery court there. In the legislature, by the way, in the new session, the old lame duck session is just ended or ending. But when the new session begins, there is an assemblyman from Belleville, New Jersey, who is pushing and sponsoring, it's in committee at this point, for a gambling court, which hopefully again will be renamed Gambling Recovery, or just associating the drug court and the gambling court with recovery courts, because in so many instances, the illegal activity of problem gamblers is mostly associated with the fact that they are addicts, just like drug addicts, just like alcoholics, and their illegal, their inappropriate behavior stems from their addiction, their disease, and they end up in the court system. I'm working with probation people in Monmouth County and Ocean County, and so many people are multiply addicted. They start with one addiction, pick up another, and then a third. And I'm a part of Gamblers Anonymous, have been since 1976. And there are many people in Gamblers Anonymous rooms that are dually or triply addicted. So in many instances, the people that you people are dealing with have the hidden addiction of problem gambling. It isn't as obvious because a problem gambler doesn't fall over, pass out dead drunk, or pass out from drugs, but carries on for years in a horrendous pattern of negative behavior. So be mindful, look out for, and just quickly, I'm sorry I'm taking so much time, but my information is in the chat there. If any group wants a presentation, brief or seminar for an hour with questions and answers, just contact me and we'll be happy to help. We also have 2 people on staff that are bilingual that speak Spanish. So if you are in an area where there is a Spanish community and want someone to make presentation in Spanish, that's also possible. And we're happy to be of assistance anytime. Thank you very much, Melissa.
Thanks so much, Vin. I know it's getting so accessible, and I know the Super Bowl is coming up. I know that's a high crisis time, and we appreciate your resources. And Camille, I know you're a great resource, so go ahead.
I am a certified gambling counselor in Mercer County. So what Vin is saying is absolutely true. I want everybody to be aware it's very coming up on the Monday after Super Bowl. It's called Black and Blue Monday. A lot of domestic violence happens that day because of this is your big hurrah, lose it. And if you lose everything, it's very, very detrimental. But I am a certified gambling counselor in one of very few. There's not a lot of people out there right now, but you can get trained through the Center on Compulsive Gambling. That's available as well. And I think it would be beneficial to this community, this coalition, to have a presentation on that for the hidden disease, not just for adults, but for kids as well. There's this online gambling is out of control. And that is something that we should really take a look at as well. Thank you. I'll put my info in the chat.
Thank you. That's why we've always had the compulsive gambling of New Jersey at the table. And we're so appreciative of that because of these co-occurring addictions that we see. Heidi, I know you had some events coming up. I know that has changed. Is there anything you'd like to announce?
Yeah, unfortunately, we had to cancel Teen Wellness Day, which we're so disappointed. We were going to have a lot of folks come in and educate our kids. Vic was going to be there. Melissa was going to be there. We had a number of people that were going to be in attendance. So we're really sorry we had to cancel that. But the one piece of news I would like to share, and Carol, if you're still on the call, you might be interested in this information as well. But since Melissa provided such great news the last meeting I was on, that in the state of New Jersey, we no longer need to have parents opt in to have their students surveyed. We are going to be embarking on the Search Institute's Attitudes and Behavior Survey, hopefully in March. This will assess student strengths, their supports, but also talk about their at-risk behavior. So drugs, alcohol, sex, suicide, things like that. So we're really excited about that. And when I spoke to the folks at the Search Institute, when there are no parameters or no boundaries as far as surveying youth, what percentage usually participate, and they said about 75%. So for us to get 75% of our 6th to 12th graders surveyed, I think is going to be a tremendous amount of data that we are super excited about. So just wanted to let everybody know that. Thank you.
And we appreciate that. We will help in any way we can, because we know the Search Institute not only does our 4 core measures, but it definitely helps us to understand which risk and protective factors we need to focus on. So great work there, Heidi. I know doing surveys is literally one of the most annoying things in the world. So I understand. Anyone else? Does anybody else have any events, any trainings coming up? I know our numbers are dwindling, and I don't want to keep you for the rest of the day. So does anybody want to share anything? Jayshree, I did see you came on. Thank you so much for being here.
Melissa, I sent you an email. It has a brief PowerPoint on what we do as Counter Drug. You might be able to share with everybody, and as the updated information. So
Fantastic. We really appreciate that. That will go out with the minutes and the notes from
No
today.
problem.
All right. Well, without further ado, we're going to go ahead and adjourn. Our next meeting is the second Wednesday. Our calendar this year is pretty easy. It's going to be February 9th. We are going to meet the second Wednesday of every month this year, except August, which we take off for the summer. So if you know other organizations or other even interested community people, community groups, parents, individuals, it doesn't matter. We would love to have them here. So please let everyone know. And I hope you have a very safe January and, early February, and have a happy and healthy first month of the new year. So thank you so much. And I will follow up soon with notes and with some of those resources. So thanks, everyone. Take
Great
care.
meeting, Lisa. Great meeting.
Thanks for having us.
We appreciate it. Thanks for being here. Sergeant Martinez, thank you so much.
Thanks, Melissa.
Oh, hi, Jayshree. How's your dad?
Yeah, he came home today.
He did?
Yeah,
Wow,
we got him home today.
That's
Yeah.
wonderful. Well, please
Yes.
make sure that you rest. I know that that's not really
Yes.
your thing, but
Yeah, I just like to hear just so much information. That was a great meeting. Thank you. I'll follow up with you soon.
okay. Well, we
Thanks,
had a
dear.
great presentation from the Counter Drug Task Force, and it's definitely an underutilized resource that we haven't been taking advantage of.
Yeah,
And
I'll sign up for the action team too. I'll talk to you and then I'll
Okay.
go where I'll talk to you later. Thank you so much, Melissa. Take care.
All right.
Bye, everyone.
Okay, bye-bye.